admire those cancer survivors, for those who actually have went through the process and everything. As a public, we don't walk their shoes because we don't actually went through the sufferings that they go. But the least that we could do is that we celebrate them. Nothing we do would ever actually be equal to what they have went through. But at least Pink October share our feelings, our views, the heartaches or the difficulties, that these cancer people are going through. Our tagline is Care for Life. Our efforts at KPJ should start from home, where we care for the life of the people, which is closer to us, which is our employees, our relatives, and our friends, and the rest of the public. With the advancement of healthcare that we have today, right, early screening will allow us to have early detection, and the treatments that we choose will allow us to curb this or to manage, in terms of how we deal with cancer. In terms of approaching of our cancer patients, or whoever that actually came to our hospitals, first and foremost, I think we already have quite a holistic cancer center. We already have about 5 centers. So this center actually provides quite a comprehensive service for cancer patients from early detection until what we call is the treatments to the end that you have to go through for chemotherapies and radiotherapies. What sets us apart from the rest, the uniqueness at KPJ is that one is the services that I said is actually from end to end that we provide. We also actually have what we call a support group, where actually help to support the patients when they early diagnosed or when they were first knowing about their cancer. So we actually help them to go throughout the journey, because being diagnosed as a cancer patient is not an easy journey. How do I get through this, So that is already quite a very big question for you to answer. And then how do I convey to my spouse? How do I speak to my children? Because this fear is not only mine, it's going to be the fear of theirs as well. So this kind of journey, right, I think it's unfair for a patient to go through alone. So at KPJ, we believe that this journey, it should be taken together with the patients. If you need us to help you in terms of how to communicate to your family, how to relate to your family, because I knew that it's easier said than done, because we are not walking in their shoes. The support that we give to the patients upon breaking this news, it's the most important, the uniqueness of KPJ. Even at KPJ, to show our support in this Pink October, we actually already have a free health screening for our employees above 45 years old. So we encourage for our employees to actually do this health screening for early detection, and as well as for us to assist them to go through the process of curing. The fear of unknown and the fear of knowing is something that we should be able to assess. Which one that we are, we want to know. Not knowing or knowing and how to deal with it. And the message that I want to say is that we women are strong and brave, and we will always take that position, to always stay strong. But in order to stay strong, we have to overcome our fear.